My name's Lizzie, and I am an Immunotherapy Clinical Nurse Specialist. I proudly registered as a nurse in 1998 and became a critical care nurse, practicing in Canada, New Zealand, and England. In my next chapter, I was self-employed for an organisation that provided medical advice for the travel insurance industry. This also included doing associated commercial repatriations and air ambulances, bringing British citizens back to the UK. Over time, this progressed into advising for the Foreign and Commonwealth Office and other UK government departments where employees are based overseas to ensure that they got medical care to the standard of the NHS. After I had my son, I started working for the Nuffield Health. This led to my current chapter as an Immunotherapy Clinical Nurse Specialist. Based on my experience, I can look patients in the eye and say, I believe in immunotherapy. Yes, some people do get side effects, but through close working relationship and patient education, these can be caught early and successfully managed. I feel privileged to be working in this evolving and expanding field. As the Immunotherapy Clinical Nurse Specialist, I work in a day oncology unit, specifically looking after our patients receiving immune checkpoint inhibitor therapy, covering different types of cancer. Within a 6-month period, our unit has experienced an approximate 250% increase in immunotherapy patients. My objective is to keep my patients safe. And I do this by developing a trusting and honest relationship with these patients and sometimes their loved ones. This is often established during a very thorough pre-assessment. And from my experience, if good patient education is given, this in turn empowers the patient. They understand when to seek help. And because a good working relationship has been forged with myself and my unit, patients do call appropriately, making for a proactive service. Side effects are caught and managed in a timely manner. All know there is a high level of suspicion that any new symptoms could be treatment related. And it's not just about side effects. I aim to help maintain and improve people's general well-being through information on diet, exercise, and when required, helping with mental well-being. In turn, improving patients' ability to stay well on treatment. It is a privilege to be working as an immunotherapy clinical nurse specialist and watching treatment of many different types of cancers being revolutionised.